Good evening, I'm Amy Robinson, and welcome to Ask the Specialist. Tonight we ask the senior care specialist, just ahead on CMU Public Television. Welcome back to Ask the Specialist. The number you need to remember to join in the conversation is 800-727-9268. And let me introduce you now to the people that you'll be asking the questions of. Welcome to Shannon Patrick. And Shannon is with the Social Security Administration in Mount Pleasant. Shannon, it's good to have you here.
Thank you, Amy. Glad to be here.
And Barb Frankenfield with the Isabella County Commission on Aging. Barb, good to see you again.
Thanks, Amy.
We are looking for your questions as we ask the specialist this evening, but let's get started with a couple of questions. One, Barb, that I think that perhaps you deal with a lot is people maybe who are having difficulty with the Medicare D prescription plan. What kind of advice can you give folks?
Well, I would suggest if people are having trouble using their plan, or maybe once they've gone to the pharmacy to use it and it isn't exactly what they thought it would be, give a call to their local council or commission on aging, senior services, and find out if there's someone who's specialized in Medicare D. We are in Isabella County through the Commission on Aging, and I would ask some questions about the plan. One of the social workers can go on the Medicare D or the Medicare website and actually look up the plan for them. So it'd be, if they're not finding that the pharmacist is able to help, and they're really excellent too, give your local council or Commission on Aging a call.
And so let me get a little perspective here, because we're covering such a huge area, and of course so many people wouldn't be in Isabella County, but generally speaking, a Commission on Aging is a good place to start with a lot of questions, isn't it?
Absolutely. Commission on Aging, Council on Aging, Department on Aging, Senior Services, every county has services or resources for older adults. And so I would start in the county in which you reside.
Okay, very good. And Shannon, another office people don't often get away without stepping into is Social Security.
Right.
And I think a common question maybe you get is, when is a good time to think about drawing retirement benefits?
Well, that's a deeply personal question, and there are a lot of variables that people take into consideration. But what we do at Social Security is to outline options for individuals, to allow them to know what options are available and the advantages and disadvantages of each. The thing for many people to keep in mind is that the longer that they wait, the larger that their benefits become. I would also say that, again, many people really don't think about how long they have to live. Men are living on average now to 82 years of age, and women in the United States on average are living to 85 years of age. And you have to think about the long-term effect of Social Security, because it's going to be one of, if not the most important provider of your income in retirement.
So let's talk about that. Now, what is full retirement age now, and why is it important to know that?
Full retirement age is the age at which we stop reducing your benefits, and it's also the age at which something called delayed retirement credits begin. For people born between 1943 and 1954, that means that they have to be 66. Actually, the month that their 66th birthday occurs is their full retirement age. And for those people who were born in 1960 or later, they have to be 67 years of age to reach their full retirement age. For the people born between 1955 and 1959, they add the 66 and 2 months to each of those years to build a ladder to age 67. The key about the full retirement age is, again, that for benefits that begin before the full retirement age, there is a reduction in the Social Security benefit. It's a monthly reduction for each month prior to their full retirement age that they begin benefits. And conversely, on the other side of the full retirement age, they can qualify for a delayed retirement credit to increase their Social Security benefits after their full retirement age. So it's a continuum that works both ways, and it's very important to know what you can and cannot do to match maximize the amount of your Social Security benefit.
And that is important. I understand you brought us a graphic
Yes.
that we can use to kind of
Sure.
depict this. If we can have that up, please, so we can take a look at the graphic that that Shannon provided. And there we have it. Could you explain that briefly
Absolutely.
for us?
In our example here, this is a very basic example, but it applies to all retirement benefits. In our example, the person qualifies for exactly $1,000 a month at age 66. So, as you probably know, your benefits are reduced if you start before that. About half of the people who apply for benefits actually sign up for benefits at age 62. So in this example, this individual would only get $750 a month. Okay? But as you can see, as you get older and there is less reduction, the amount of your monthly benefit per month increases. The amount of the reduction is actually permanent. And in addition to that, you also have to consider the effect that it would have on survivor benefits if your spouse is counting on getting some of those benefits from your record should you pass away. Conversely, on the other side, Social Security pays about 8% per year for each year that you go through after your full retirement age to wait to draw benefits. So to use in summary here, in this example, the individual would get only $750 at age 62, but at age 70, they'd get $1,320 to take advantage of that. That's nearly doubling the amount of their Social Security benefits over their lifetime by simply waiting 8 years. We recognize that not everybody is able to do that. Your circumstances, your health, your propensity, or the likelihood that you're going to live to old age can make a huge difference in this. So we don't tell you what to do, but we want to make sure you understand the options for doing that.
Okay, very good. And that was a very helpful graph to really put it out in front. Thanks very much
You're
for
welcome.
that. So, Barb, I want to get back to you for a minute, because in addition to the nuts and bolts of how are you going to fund your retirement and when should you consider the things that Shannon talked about, are some of the physical and social and emotional issues that can go with aging. So, if someone suspects that a person they love might have Alzheimer's disease, how should they address that?
First, I would suggest that they speak to their physician. But to get a proper diagnosis of Alzheimer's or some other irreversible dementias, you want to have a geriatric assessment. You want an assessment that takes into consideration physical problems or concerns as well as psychological concerns. And with the geriatric assessment, what they will be able to tell you is it a reversible dementia? Is it an irreversible dementia? They will be able to tell you a little bit about the stage. They will be able to tell you if there are medications that might help to nothing reverses it, but to help slow that down. So those are the kinds of things that, and you do want a geriatric assessment. You can't walk into a physician's office and talk about a couple of situations that you might have and then have someone say, oh yeah, you have an irreversible dementia. You have to have the testing, and the geriatric assessment is a way to do that.
And can your primary care physician give you a referral for that?
Absolutely.
Okay.
And that would be where I would begin.
Okay, very good. Now, we have a question here from Farwell. Does the Commission on Aging, Barb, have someone who can help an older adult make changes to their will?
There would, most of the counties in the state of Michigan would have access to attorneys who are able to do that for little or no cost. And probably the easiest and the best way to do that would be to talk to your local council or Commission on Aging. In the Isabella County Commission on Aging, we have an attorney who comes twice a month. We have the number to call to make an appointment, and you are able to see the attorney to help with those kinds of things. But start again locally with your council or Commission on Aging.
And as we're tiptoeing into tax season here, or maybe running too fast, as the case may be for some folks, does the COA often offer assistance in that regard too?
Absolutely. Every year we have AARP-trained volunteers who come in and will help people all day. They help people with taxes. They have to have an appointment at our agency. You must have an appointment. But it would also be something within your county. Talk to the senior services and find out who in that county will help with the taxes.
Okay, very good. Thanks so much.
Sure.
And I am looking at this form. I'm not sure where they're from, but I'm reading that there's a grandmother. I think this one's for you, Shannon. 90 years old. She'll be retroactively approved, I think it is, for Medicare B. Can anyone help with the case, since she's always been responsible for paying her own way?
Well,
And there are just a couple words I'm not following here, so.
I think that there may be some help because sometimes the Department of Human Services has programs that pay for the Medicare deductibles and also pay for the Medicare monthly benefits. They come under the heading of buy-in, but there are also things, I'll just use the initials for them. One is called QMB and one is called SLMB, and you'd contact your Department of Human Services for help in doing that. You want to add anything?
Oh, I was wondering if they were talking about a late enrollment penalty for Medicare D. Is it D or B?
B as in
B.
boy is what I'm seeing here.
Okay, and then I would agree with Shannon. I think that the other thing is with your local Department of Human Services or Council or Commission on Aging, because a lot of the social workers or case managers who work at an agency, Commission or Council on Aging, would be able to help with the Medicaid process.
Okay. Now, if there's one thing that is really relevant this year, it is trying to stay warm in this really persistent winter. And of course, then we hear that the governor has declared a state of emergency for propane in Michigan. Prices are rising. The winter is a tough one. So Barb, let me ask you, what sort of financial programs or assistance might be available for folks who need to look into that?
I think that probably most of the local agencies, councils on aging, would have some information about how to receive some assistance for utilities or propane. We've had a lot of requests for that recently. We are very fortunate in Isabella County in that we have an unmet needs grant from the Saginaw Chippewa tribe. They're very generous to us and to the elders in Isabella County and to the other counties in which they have gaming. So we're fortunate in that we are able to tap into that fund to help with utilities. But you're absolutely right. We've had numerous calls recently about propane. People are using a lot more of it just to stay warm. But there also are some state programs that might be available. And that, again, would be contact your local council on aging. I'm going to sound like a broken record, but that would be where to start.
Okay, very good. We have a question from Clinton Township. Shannon says, this person is 62 years old and retired. My husband is still working. Can I collect on his Social Security?
Well, actually, the answer is not yet. There's a requirement that the spouse that you're claiming benefits on has to actually be drawing benefits themselves for you to do that. So what is going to happen is that when her spouse comes in to retire, we're going to check to see if we can pay her any additional benefits on her husband's record at that time.
Okay, very good. And then a question from Heartland, again on Social Security. You discussed the retirement age.
Yes.
And you also discussed average lifespan.
Yes.
And this person is looking for a little bit more math. What is the average lifespan of men and women once they're on Social Security?
Well, that's a very interesting question because I read somewhere this week that if you are 65 years old, then you have at least a 50% chance of reaching 90. So that's really significant.
Yeah.
Average life expectancy stats are predicated on everybody from infants to, but once you get to be old like me, then yeah, you have a pretty good chance of doing it. But your family history is very important. In my mother's family, for example, checkout time is age 78. You can just pencil it in because they're all going to go. My father's family all lived to be 96, so I don't know what to do.
Okay. Well, let's hope you pulled from your father's genes in that
sort of
regard.
hoping that, yeah. You have to plan that way, that's for certain.
Exactly. Okay. Now, let's take a look at, again, some issues folks might be dealing with as they age or perhaps someone they know. Barb, if someone suspects a family member, their mother perhaps, is dealing with depression, what are some signs and how can someone help?
Some of the signs for depression, I'll look at, is there a change in their habits, eating habits? Is there a change in their hygiene? Are they not doing some of the things that they've always enjoyed doing? Will they not go out when they normally were pretty social? And I think at that point, probably talking with a local community mental health person who might be able to provide, or private therapy, who might be able to provide some therapy, counseling, make sure that there's not something, maybe your local physician, so that you can make sure there's not something physical going on as well. But I mean, everybody feels the blues, but when it gets to be that it's limiting the kinds of things that they do normally, it's time to talk to their physician, talk to a therapist.
And you have referred people an awful lot to the Commission on Aging, which makes perfect sense. There are so many resources there. But let me ask you this, does a person have to be, meet any income guidelines, perhaps be on a limited income to receive services from a Commission on Aging?
No. There are certain programs where there are income guidelines, and it just depends on the service. But primarily something that would help to allow people to remain in their own homes. Those are the kinds of services that are usually on a donation basis. And particularly if they're federal funds through the Older Americans Act, there's a mandate that we aren't allowed to charge for those services, but we are allowed to accept donations.
And if I live in Mount Pleasant and my parents live in Flint, how do I work with the COA across distance?
Okay. And what you'd want to do, and we have a number of those calls, is give a call to the Commission on Aging in the county in which you reside. Let them take a look and find some of the resources that would be available in Flint. What we like to tell people is, we'll do the calling, we know the lingo, we'll make sure that you don't get 4 or 5 different questions. You know, do you want number 1 when you call, or do you want, press number 2? We'll be the ones that can tell you who to talk to and what the resources are in those counties. We can find that out for folks.
Alrighty. We have a call from Sand Lake. Shannon, back to you. Saying they get a lot of mail from Washington and companies asking for money to guarantee the Social Security. Does that do any good?
I would say that I wouldn't do that. There are very many people that take advantage of the fears and concerns that people hear on the news every day. The power to get things done, though, is through the Congress. And so I would say that if it were my money, I would be investing it in communications with my representatives in the House and Senate to change the law and to secure the future of the programs that you have concerns about.
Okay, very good. And let me mention, too, I just heard recently, we received a press release from a law enforcement official saying that there is a scam.
Yes.
It hasn't been in this area yet, but it easily could because it's over the phone.
Yes.
And this is someone who calls seniors or calls individuals and says they're from the IRS. They transfer you to various departments to apparently try to prove credibility and say that you owe back taxes. They've been trying to reach you, but gosh, if you'll just send them the money now, then you don't have to worry about going to jail and being prosecuted.
Fraud right now is rampant and at the highest levels it's ever been. In addition to the situation you listed, we're getting reports, of course, about credit card fraud predicated on the use of someone's Social Security numbers, tax fraud where they're filing tax returns on people's Social Security numbers, and any number of other things to take advantage of people. It's very important not to carry your Social Security card or your Medicare card with your wallet. It's very important not to give out your Social Security number over the phone. We know your number, and if we call and ask for the number, we'll give you the opportunity to verify it's us before we ask you anything else.
Sure, sure. We have a question from Mason. What is the Medicare deductible going to be this year?
Well, can I cheat?
Absolutely.
Okay.
Give
I'm
you
a
cheat
social
sheet.
worker, that's numbers.
All right. All right.
We'll go to the
kid.
numbers guy.
Okay, so the premium for Part B this year is $104.90. The deductibles for the hospital part of Medicare are $1,216 for the first through the 60th day. That represents only about the first day and a half of charges. If you are in for 60 to 90 days, the additional charge is $304 a day. And if you're in from 91 to 150 days, it's $608 per day. Skilled nursing care is $152 per day, and I think that's about it. So,
And I think just to also be aware that the cost for Part B, as in boy, will go up based on your income as well.
absolutely.
So-
About 5% of the individuals with Medicare Parts D, the prescription drug plan, and Part B are affected by their income. And if you have income of $85,000 or more per year, you may very well find that your Medicare premiums are more than everybody else's.
Absolutely.
Okay. Now, if everyone couldn't write those numbers quite fast enough,
Sure.
What is the website where they can get that information?
They can get that from our website, www.socialsecurity.gov, or from medicare.gov. Either one of them will have them. The Social Security website is really, really good because it allows you to get a million things, really. There's access to 150 forms and 200 pamphlets. There's access to your benefit amounts. You can request Social Security cards. You can request Medicare replacement cards. The list is really, really long. And of course, you can file claims for retirement, disability, Medicare, spouse's benefits. The only thing you can't do yet is survivor benefits and filing for supplemental security income, or SSI. But again, it's a great place to start, the best place to start in dealing with Social Security.
And it's
Okay.
a very easy website to navigate
Well, and I
as
was going
well.
to say, if someone is maybe a little intimidated by all the options, Commission on
Absolutely.
Aging will help?
Commissioner Council on Aging,
Yeah.
absolutely.
Okay, very good. We have a question from an individual saying, my wife is 62, I'm 66. I plan on working until age 70 if possible.
Okay.
We are both still working. Is it to our advantage for my wife to start collecting Social Security now at 62, even though we are still employed?
Wow, that's a great question, and that's one of the option questions that comes from delaying your application for monthly benefits. I need a little more information to give a good answer, but just let me say that is certainly one of the options that the individual can have. There's a couple of terms that are used. One is called start and switch, where you file for benefits on the spouse's record, and then you collect delayed retirement credits until you are older, and then file. The latest you should do that is age 70, and then you get the extra 32% to take advantage of delayed retirement credits. The other option is called start and switch, where you have an individual who begins on one record and then flips over to another record later on in life. So those are very good options, but you need us to give you a hand to figure out what's in your best interest. There's an awful lot of variables. The work, the amount of the work, their plans, their life expectancy, that's what we're there for.
And you know, Shannon, I have to ask, because there's that old joke about I'm from the government and I'm here to help you.
Yes, I begin every speech with that, and the reaction is always that.
But I have been into your office, and it is a very friendly place. So you do have staff who really want to help people.
Absolutely.
Even though you're from the government.
Even though, and especially because I'm from the government. Yes.
Okay, very good. Barb, let me ask you, part of the aging process so often involves the caregivers. If someone isn't able to maintain care of their own personal needs in its entirety. So this question is, if I'm a caregiver for my partner, I'm tired, I don't know where to turn. What sort of services are available, not only in Isabella County, because I know there are some very great options here, but even on a wider scale that people might be able to consider?
Every county in the state of Michigan should have a program called caregiver training. Caregiver training program is a person who specifically works with caregivers to answer questions, to provide support, to give resources. So most councils or commissions on aging, local agencies, may have a respite program where we would give some time away for a caregiver, but also things that, for instance, my partner will no longer take a shower, or my partner doesn't want to eat anymore. What do I do with that? I have questions I want to ask a doctor. How do I phrase those so that I get the best answers? That's the kind of thing the caregiver trainer will respond to. The other thing is, with, at least in Isabella County, I know it's true of other counties as well, we have a spring and a fall training specifically for caregivers. Ours in April will be April 9th. It's going to be the health assessment team from the CMU Medical School. They're going to come in and talk about Alzheimer's, the latest things going on, what about medications, and those kinds of things. And there are a number of other counties in the state who also offer those kinds of programs.
We just have a couple of minutes left. Let's see if we can get a couple more questions. From Higgins Lake, is there an agency or organization that can help an 80-year-old get eye appointments? Is this Commission on Aging?
Call your local council or Commission on Aging.
I mean, that really is the go-to
That
resource when
absolutely is.
you're not sure where to go next.
Absolutely. They know local resources, they know state, they know federal resources. Start there.
And Shannon, I think folks have sometimes found that maybe retirement isn't completely what they thought it would be. And so from Gaylord, we hear from someone saying, if you're drawing Social Security and you want to go back to work, how will that affect the Social Security? And they're talking about working full-time.
Right. There's all kinds of options there also. One of the things that can happen is that the benefits can stop for a while. And again, the good news is if we're not paying you and you've taken a reduced benefit, when you get to be 66, we'll recalculate your benefits and you're not charged for any months that you weren't eligible to be paid Social Security benefits. But there is something called an annual earnings test. And for people younger than age 66 this year, they can make $14,480 and be considered retired. If they make more than that, Social Security holds back $1 in benefits for every $2 that they have in wages or net profit from self-employment.
Now, from Lake City, someone's asking, we've been told never to give out our Social Security number. Who is it okay to give it to? And we have just about a minute left.
I can't think of anybody except perhaps your doctor so that they can do the billing for Medicare. And of course, you may be required to give your Social Security number if you're applying for bank loans or credit cards or insurance policies or bank accounts. But those are things where you have the choice to give it to them or not. You're not going to be required to do it. In fact, by law, the only thing that you're legally required to deal with for Social Security numbers is Social Security.
All right, very good. Thank you both for being here. Thank you for your questions. Thanks to Shannon Patrick with the Social Security Administration and Barb Frankenfield with the Isabella County Commission on Aging.
You're welcome.
Thanks to you again for calling in your questions and our phone volunteers for getting them to us in such a prompt manner. You can look to our Facebook page for answers to questions that we weren't able to get to tonight. And we invite you to join us next week. It's a special edition of Ask the Specialist. We're talking with experts about substance abuse trends and prevention. And we hope you can join us for that. I'm Amy Robinson. Good night.